It is my absolute pleasure to warmly welcome Professor Michael Okun, who does not need an introduction to movement disorders world and Parkinson's disease world. He's very well known in the Parkinson's disease and movement disorders community, and he is one of the authors of much talked of the book Ending Parkinson's Disease. More on that to come later. Mike, thank you very much for allocating time from your very busy schedule to talk to World Federation Neurology YouTube channel. As you are aware, World Federation Neurology and Movement Disorder Society are joining forces together to celebrate 2020 World Brain Day, dedicated to the massive, ambitious campaign of ending Parkinson's disease, which is very close to your heart. How excited are you to see that this is happening despite the fact that we live in the middle of a pandemic?
So first, thank you for having me on, Tissa. It's really an honor to be with you, and we are really excited and almost giddy about World Parkinson Day, and especially with the idea that we need to come together and begin to create the right framework and take the right steps and start to be more charismatic and move forward with ending Parkinson's disease and start to understand what that means. And in terms of the pandemic, we are just our hearts go out to all the people that have been touched by this. And I know for all the healthcare workers, it's like our 9/11. It's time for us to step up. And we've got a lot of patients who are sick in our own hospital here, and a lot of patients who need care. And we've tried to put some papers and some guidance out for people on how to help to deal with the pandemic, and have doing a lot of series with Parkinson's Foundation, on this at parkinson.org/coronavirus, all one word, coronavirus, and really trying to help people out. And so we really are concerned about our Parkinson patients that are stuck at home. We want to keep them safe, but also we want to make sure that they don't decline. And so there's a lot to unwrap with what's going on in the world, today, but we need to pay attention to making sure that we're helping our Parkinson disease patients, as well as thinking about how we're going to move things forward.
I totally agree. I don't want to convert you, as you very well know. Parkinson's disease itself is a pandemic. We have seen from GBD paper how the number of Parkinson's disease patients were doubling from 1990s to 2016. I have seen your inspirational live Facebook chats and presentations, which bring tears to my eyes sometimes, how passionately you talk about these patients. Let's hope the World Brain Day campaign that WFN and NDS is putting together would give enormous amount of strength to people like you, as well as the biggest heroes, our patients with Parkinson's disease worldwide. I'm learning every time when I talk to someone out there in sub-Saharan Africa or some of the Asian countries, the challenges that these patients are facing. My motto is Parkinson's disease create a universal amount of suffering to our patients wherever they are. Hence, finding a solution has to be somewhat universal also. I think out of this pandemic, like the most furthest corner of planet, Australia, I'm talking to you while you are sitting in beautiful Florida. We have connected the world through internet like no other. Let's hope that something positive would come out. Mike, I'm going to change the discussion to a different direction now. I wanted to know about you on behalf of our viewers of World Federation Neurology channel. As you know, we represent over 122 countries. The idea is I want those high school kids and medical students and physician trainees out there, when they watch how the make-up of Professor Michael Okun was born, hopefully that would inspire some of them to go on and do great things like you do. Tell us about your childhood and your high school days and university days. What made you to be interested in medicine?
Sure. So, I think that first, let me just say I'm extremely hopeful for the future of medicine. And I think that the most important thing that we can do is to mentor the next generation. And I believe in that growth. You talked a little bit about the pandemic and how things can grow, but we can also get exponential growth in education and inspiring the next generation. Each life that we touch can touch so many other lives, and we can really affect change in that way. And so, I grew up in a family that moved down from New York. So I grew up in Florida and in South Florida, and my first love is history. So I love to read history and to read lots of books, and I love to write. And and in my early days, I did a lot more writing of short stories and poetry. I have an old poetry book, and so I believe a lot in the humanities. My life, you never know where things are going to turn or where your opportunities are going to come. But when I went to college, I studied history, and I have a bachelor's degree in that area. And I always saw myself as a teacher, and teaching the next generation. And I saw myself as somebody who was primarily passionate about the humanities and about history. And as I was going through my studies, there weren't a lot of jobs for history professors. And so, I always joke a little bit that, and it's half joking, half true, is that, when it came time to decide what I was going to do, a lot of my history professors, they were not super happy with their jobs, and they encouraged me to think about other things. And I come from a Jewish family, and if you talk to the Jewish father, they always say, you should be a doctor, a lawyer, or an accountant, right?
Mm-hmm.
And so I always joke that I decided to take the doctor route, and my journey was more to try to help people. So I saw the doctor as somebody who is more of a healer, and that's a little more Eastern medicine than Western medicine. And I saw myself more as a black bag family practice type doctor that would go out to people's houses and try to help them with their various illnesses. And when I got into medical school, I actually was part of a program that's now become a 4-year medical school. But if you did this program, you went out into rural America for a year, and then transferred to the University of Florida. It was called the Program in Medical Sciences at Florida State University. And that was a great experience for me. But I also was introduced for the first time to the brain. And some kids, when they see the brain, they run because it's so complicated with all the different pathways. And, even though it's interesting, it's very difficult to answer questions and to test on if you don't understand it. And for me, it was like a light bulb. It just, once I saw it, I just, became, I don't know if the right word is addicted, but certainly drawn and felt that this was, something that was really interesting, and it made sense to me. The pathways were beautiful, and it's still the world's best supercomputer. You can talk about Apples or PCs or Steve Jobs or Bill Gates, and I respect all of those people, but the best supercomputer is still the brain and the nervous system. Yeah, and so it's super exciting, and things just kind of, I took my opportunities as they came along. I probably couldn't have told you the difference in any very clear or articulate way between a neurologist and a neurosurgeon when I started medical school. That's kind of at the level that I was at. And you learn along the way, and you see their opportunities, and try to find good mentors and people that you want to emulate and to be like. But I still feel like there are so many pathways that, as a young person, that you could go. And I always tell people that the trick is find your passion, spend as many minutes out of your day on your passion. And if you're lucky enough to get somebody to pay you to do your passion, even better. But even if you don't get that last step, if you can spend your life doing the things that you're passionate about, the things that you love, you'll have the greatest chance, I think, to impact society in a positive way.
I think you hit the nail on the head. This is probably the best treatment for burnout. Those physicians or surgeons who are passionate on what they do, they would almost guarantee to not to see burnout at all. Mike, you were a fabulous teacher. I have attended some of your teaching sessions during my younger days at American Academy of Neurology as well as MDS. You make things so simple, especially when you teach those deep brain stimulation stuff and so on. I think I bump into some of the meetings afterwards, and you continue to demystify some of those things. You kept yourself true to a fabulous teacher. Let's move towards the book. What made you three to get together and write this book on ending Parkinson's disease? What's the concept behind ending Parkinson's disease, to demystify this to our viewers before they hit into the book?
Yeah, so back in 2013, I had written a book for patients that was called Parkinson Treatment: 10 Secrets to a Happier Life. And it was, you know, a really simple, but I thought fun read for patients and for family members. And it turned out to be a runaway bestseller, which was a big surprise to me. And most importantly, it helped a lot of people, and opened my eyes up too, because, and I'll tell you, for all the young people that are watching this, you know, all the papers that I've written over the years, hundreds and hundreds of papers and abstracts, way more people have read that book about 10 tips than all the research papers that I've written. And so you have to think of your life too, and impact, like where you've had your impact as well. And so, and the surprises that come along, and learn from them. But in that original book, one of the constructs that I talked about was the idea of a Parkinson disease pandemic. And, you know, pan means all, and demos means people, if you look back to the Greek derivations of the words, and even some Latin. And if you look at the definition of pandemic, the word itself wasn't originally always associated with infectious diseases. And I think it's completely appropriate now that the World Health Organization has taken this word, and when we use it, the public understands that we mean these infectious diseases like COVID-19. But if you take apart the meaning of the word, it really means that you have lots of people in lots of areas that are affected by, you know, some syndrome or disease or problem, right? And there's a growth rate, you know, in a pandemic, and so things have to grow in a certain way. It doesn't necessarily spare any one ethnicity or culture, but as you can see in the current pandemic, it can pick on different ethnicities and cultures, and understanding that could be important. But if you actually look at all of the 4 or 5 things, and we review this in the book Ending Parkinson's Disease, if you look at this, it's stunning, because you can take a disease that's a neurodegenerative disease, and you see it beginning to grow across the globe, and to meet, you know, many, if not arguably all, and I think most experts would agree that it meets all of the definitions of pandemic, but we wouldn't use the word pandemic because it's not infectious, or at least we don't believe it's infectious. And when you put together the growth tables, and Ray Dorsey is an expert in this area, so he began to look at the growth. It turns out that it's probably the most rapidly expanding disease in neurology. And it's not just that the population is aging, and when old people, when their brains age, they get degenerative changes. The variables, clearly, it's not just that. That's one of the factors. And so we have this expanding disease, whether you want to use the word pandemic or not. And in the early days of the book Ending Parkinson's Disease, we were operating on, actually, the one of the early titles was the Parkinson pandemic, you know, based on this older work. And really, we began to dive into the philosophical idea of what it has taken in the examples that we've seen in medicine to really get a hold of other diseases. And so we carefully took apart the polio story, and we dissected the HIV story. We took a look at the breast cancer story, and so on. And so the book is an interesting read because it's not a chapter book. It's a book really about philosophically, if you wanted to try to end a disease. So the World Health Organization did declare polio eradicated, as a disease. We really wanted to get to that point. What lessons can we learn from these other diseases to move forward? Now, it might be a little controversial for us to say, well, ending Parkinson's disease. We all know, the experts know that it's not one disease, but that's one of the challenges, right? That we have to think through is step by step, what are the things that we need to do? And when we looked at that, we really, it became apparent to us that there's a formula. And the formula is what we refer to as the Pact. The people and the groups and the partners that have been successful have really keyed in on prevent, that's the P of Pact, advocate, okay, care, and develop treatments. That's the path. And so that's how we got into it. We wanted to be a little bit controversial, a little bit disruptive in this book, and challenge people to think about these things that they may be uncomfortable thinking about. But if we're going to get to the next level, we're going to have to, really raise our game. And I have a slide that I showed sort of grading where I think we are. And as active as I think I've been in the community, both as the medical director for the Parkinsons Foundation since 2006, and lecturing and researching and writing, I still grade our response as an F minus. I don't think we have done the things that the other diseases have done to really move the needle. And so we together, came together rather organically. So Ray Dorsey is, the stats guy who understands diseases and how they grow, and he's the one that always gets quoted for, like where the healthcare systems are going to go bankrupt if we don't get control over these degenerative diseases. He's the guy that we quote for how the growth rates are going. And then you take Boss Bloom, he's the guy that really leads the way in developing the care networks and how we're going to put together, ways to care for people and to advance the field forward. And take, the CEO of the Michael J. Fox Foundation, Todd Scherer, he and I were at Emory together. He was a grad student when I was training as a fellow. And though we didn't know each other at that time, he was in Tim Greenemeyer's lab. We find ourselves again together. So you ask how we all came together, and he's obviously a huge advocate for Parkinson's disease. And then I've worked for the Parkinson Foundation and been involved, a lot on, not only treating patients, but doing a lot of clinical trials and developing a lot of devices and trying to, be on teams of people that are trying to pioneer new approaches for Parkinson. And so I think we make a pretty good team. It would be arguable whether you call us the dream team. We certainly enjoy each other's company, but I think more than anything, we've challenged each other, and we try to be disruptive and about this issue, and tried not to step away from it. So I think in the past, we've all kind of stepped away, like you can't say that or you can't do that. But I think that in this book, we take a little bit more editorial privilege and try to push forward and make people think about things. Like, for example, why in 32 nations have we banned paraquat, but it keeps increasing and maybe even doubling over the past several years in the United States. Yet we know if you placed a bet in Las Vegas about the risk of being exposed to paraquat and getting Parkinson later, that would be a pretty good bet to pay, especially with high exposure. So, I think we got to have these conversations, and they're difficult conversations.
I think the three of you were certainly a dream team, and my nickname for three of you is Three Musketeers. And I've listened to all three of you at various platforms, and I totally agree. And the Pact, the prevention, advocacy, care, and treatment for Parkinson's disease is really timely, Mike. I mean, we saw in 2017, we learned for the first time, on both of us we knew, but we knew on statistics that neurological disorders are the leading cause of disability worldwide. We know that neurological disorders are the second cause of death worldwide. We know Parkinson's disease is doubling. We can go on talking about all other neurological disorders. Yet, when you look at some of the hospitals, and for a manuscript, I was just going through Neurology Atlas, there's such immense disparities in available training opportunities, number of neurologists, treatment. The gaps and disparities are immense. So Pact is really necessary, and all these things that you talk about is really the key to solve these problems, even beyond Parkinson's disease. And I think three of you have basically given a nice prescription and a nudge to every other neurologist and trainee out there who had the neck to act on this. So thank you very much for putting this book out, and I hope it would continue to move and shake people all over the world. This is the year for Parkinson's disease, and I hope the other folks who are passionate on other disorders would learn some lessons and translate this to all other disorders, which can still act as a nice pact to end those disorders and nice prescription for action also. So thank you. I'm sure this is coming from your writing skills from those days. Outside medicine, Mike, what do you do most? Tell us a little bit about your family, your pastime, and what do you like to do when you do not advocate for neurology and Parkinson's disease, and when you don't write papers, and when you don't write books, and when you don't teach.
So I think it's really super important to have other things to do, you know, and to not always focus on one thing. So if we were talking to young people and trying to put a bug in the ear, you mentioned burnout, and a lot of people burn out because they give too much. And there's a wonderful book by Adam Grant called Give and Take. And in Give and Take, you know, we talk a lot about, you know, what it is, you know, what it takes to really succeed. And being a giver is important, but if you give too much and you don't have other things in your life, then you can burn out. And so my wife and I, we do a lot with charities, with local charities. So we spend a lot of our time with Tyler's Hope for Dystonia Cure, which was founded here in Florida. So we do a lot of events for them and raise millions of dollars and put them out all over the world for dystonia projects. It's one of our passions. We work a lot with the autism community here locally, and so we're trying to help to build an autism center and try to help for a new vision for the kids with developmental disorders. And so that's one. Of course, we work with a lot of the charities in Parkinson and Tourette. And so we do that, and we try to involve our kids in that too, and try to involve our kids doing charitable work. I have two kids, and so we like to do a lot of outdoor activities together. So we do a lot of bike riding, we do a lot of walking, we do a lot of walking with our dog, and a lot of hiking and nature things. And then of course, I like to say that, you know, we like to watch sports, but both my wife and I are nerds, and so we try to exercise. So we exercise a lot, but we're not particularly coordinated. And so we do a lot of reading, a lot of books on tape, and a lot of podcasts, and our kids do that as well too. So we're a little bit of a nerd family, but we embrace it. We like games and fun things as well.
One last comment to the viewers who are out there. We are in a tough situation all over the world. What inspiring word would you like to throw at them? We talk a lot during the conversation. Mike would be invited to do a talk in our virtual symposium in a few weeks' time. Also, there would be a dedicated topic that he would address at that time. Any final messages for folks out there all over the world who might come into our YouTube channel during these tough times?
Yeah, so I just want to stress that, you know, I am very hopeful, and my background is studying history, and so we get these pandemics and we get epidemics and we get these things happen. Sometimes there's 100 years in between them, sometimes more, sometimes less, and certainly we've compared this to the 1918 flu epidemic. In the 1950s, we had polio, and we learn from these things, and they're hard, and there is a beginning and there is an end, but we grow through that, and there are silver linings. And for all the young people that are out there, I'm not just optimistic, but I'm hopeful. There's one thing to be optimistic, it's another thing to be hopeful. Very hopeful for the future, and I do believe that that there's so many opportunities and so many ways that we can impact and help each other. And and there things go up and down, and we just have to learn to kind of ride along, take those opportunities and move them forward. I know that Austin, Ray, and I wrote about one of the silver linings in JAMA Neurology was the advent of telemedicine. We accomplished in 10 days in the United States what has taken us 10 years of advocacy and getting this launched. But now we've got to continue that and make sure that this continues forward, because clearly that reaching into people's homes is going to be a future of medicine. And so there are good things that can come out of these. It's not all bad, and I just think that we need to remain hopeful. And and for the young people coming out who say, well, the jobs are down, unemployment is high, think of these things as opportunities. Opportunities to get involved with the efforts. I've heard great stories about kids deciding they want to do contact tracing, be a contact tracer for a year. Get involved and let the path. Some people are in such a rush to get there, like there's some final destination to life and some final destination when you're a young person to a career. And I've got to finish college quickly, and I got to finish medical school quickly if you're going that way, or maybe you want to be a physician's assistant or an occupational therapist, nutritionist, whatever. If you're going into medicine, or even if you're not, people are in such a rush. I would say slow down. It's the journey. Enjoy the journey. And this is a life experience right now. This is the 9/11 for healthcare workers. This is our time to step up and help the world. This is why we took the oath. And you try to, as much as you can, embrace it, learn from it, enjoy some of it if that's possible along the way, and let it open other opportunities that will profoundly affect you and the way that you see the world. So hopeful would be my message.
I agree. I mean, you hit the nail on the head once again. It is all in the journey. When we are going on a hike, it's not the top of the mountain, which is breathtaking. It is breathtaking, but what matters is journey. Mike, thank you very much for your wise words and the time, despite the very short notice. We wish you and your family all the very best and good luck. And your book is terrific. And I hope during the World Brain Day campaign, given the campaign is all about ending Parkinson's disease, we would encourage our viewers to get the book, read the book, and do the Pact and join forces together to end Parkinson's disease. Those others who wanted to translate the Pact to other disorders, they are most welcome to do so also, because brain health matters. Thank you very much once again. All the very best. Enjoy the day.
My pleasure. Thank you. Thank you, Professor, and have a great day.
Thank you, Mike. Thanks.